So I'm quite interested in endurance sports, and particularly because I've got interested and started doing triathlons about 10 years ago. And having started with a sprint triathlon, which takes about an hour, I've built myself up to being able to do an Ironman, which takes somewhere between 11 and 12 hours, depending on how fast I'm going. And that's quite a significant amount of energy expended over the course of a day. What I find really interesting is that there are now professional cycling teams with type 1 diabetes who are actually performing at the same level as people without diabetes. And there's some really interesting new research that has actually studied these professional elite athletes who have type 1 diabetes and is starting to look at how they're able to perform. And the first point to say is that as professional cyclists who may be spending 5 or 6 hours a day in the saddle at a very high intensity of exercise, that these people with type 1 diabetes are actually able to perform at pretty much the same level as all the other elite athletes. So type 1 diabetes is no barrier to being able to perform elite sport, and I think that's fantastic for people with type 1 diabetes. The other really interesting thing is how these people are able to manage their diabetes whilst doing continuous exercise, because they have to fuel that, and what we find is that those individuals are actually getting about 85% of their energy from carbohydrate on the days when they're cycling, just simply because that's the only way that they can fuel that level of activity. And of course that means they have to be very careful in managing their insulin. Most of them will be using multiple dose injections, and they will be using continuous glucose monitoring to monitor their glucose during a ride. And not only do they have to think about fueling their ride, they also have to be very careful to avoid hypoglycemia, which would not be a good idea when you're traveling at high speed on a bicycle with a few hundred other people. And at the same time, avoid hypoglycemia, which might impair performance. And what these people are able to do, who really become experts in managing their own diabetes, is to actually maintain very good glucose levels throughout the day whilst they're competing, and then manage to do that reasonably well for the rest of the time as well. So I think this is really quite remarkable, and what we have to now try and do is work out how we can translate this really interesting research in people who are elite athletes to the person with type 1 diabetes who comes to see me in clinic, who wants to go for a bike ride with his children on a Saturday morning, which is probably a rather different challenge, but nevertheless I'm quite sure there are some learnings from the elite athletes that can be translated to people who are not performing at that level.